What should you do with a patient's positive alcohol screen? So your clinic is implementing alcohol screenings. This is an important step in providing whole person care. This is the second video in a 4-part series to help your practice improve health outcomes and destigmatize behavioral health issues. We know your practices are busy and unique. Every day is different. What's important is that regardless of the day, there is a standard process in place to deliver consistent, quality care to every patient. Here's what you'll learn in this video. The importance of creating a standard process for responding to a positive screen. The importance of involving your whole team to make this process work well. There are different approaches for responding to a positive screen. Handling a positive screen result appropriately is the right thing to do in providing whole person care. When it comes to screening for unhealthy alcohol use, it is important to know what to do when a patient has a positive screen result. Establishing a standard process will ensure that patients receive consistent, appropriate, and quality feedback. Your team and your patients are unique, so your process should be too. Consider what process will seamlessly integrate into your current team structure. Here's an example of what your screening process might look like. First, the patient is given a few brief screening questions in the main intake questionnaire. If the initial screen result indicates that there are some risk factors, patients should receive a slightly longer screening. This will typically happen in the exam room. If the patient declines this second screening, you don't need to ask why. Document it and share it with their provider. The provider can decide whether to bring it up again later. If their screen result is positive for unhealthy alcohol use, there are a lot of ways you can approach this. Above all, you should quickly know which designated team member should communicate the results with the patient. Who speaks to them next might depend on the severity of the patient's screen result. Create a standardized procedure for your healthcare team that indicates which team member talks with the patient based on their screening score. For example, if their alcohol use falls into the low-risk category, a medical assistant could affirm their healthy choices and share information about low-risk guidelines. Or, if the screen results indicate higher risk, maybe their provider or a behavioral health specialist has a conversation with them about lifestyle changes, community support groups, and treatment options. Design a standard way to respond that works best for your team and the patient's needs. Let's review what you've learned so far. The importance of creating a standard process for responding to a positive screen. The importance of involving your whole team to make this process work well. There are different approaches for responding to a positive screen. Handling a positive screen result appropriately is the right thing to do in providing whole person care. In the next video of this series, we'll talk about how to have the initial conversation or brief intervention with a patient who has a positive screen. When you put this into practice, you could change a life.